Hi, I am Dr. Clarence Lay. I am a consultant urologist at the Norma Medical Specialty Center. One of the specialties that the urologists look at is that of sex, and 4th September is designated by the WHO as the World Sexual Health Day. The spectrum of sexual behavior ranges from romance, sensuality, sexuality, and sex, but today I'm going to talk only about sex. Now, it's often said that sex is not important in older people, and that is actually wrong. Sex does not stop at any age. There's no expiry date with sex. So, of course, we look at it a little bit differently at different age groups. Now, what is the definition of erectile dysfunction? Erectile dysfunction is defined as erection sufficient for satisfactory sexual intercourse. Satisfactory, that's the important word. We don't use impotence anymore because it gives the idea that it's futile, it's mati, it's mati. Then erection can be defined in various hardness, 1, 2, 3, 4, although it's a bit difficult to quantify unless you look at it as compared to food. Now, unfortunately, erectile dysfunction or sexual dysfunction is often associated with a lot of comorbidities in men, like diabetes, hypertension, obesity, dyslipidemia, and of course, there are other problems with men, colonic cancer, and especially coronary heart disease. Now, therefore, erectile dysfunction should be treated as part of the total wellness of the patient by the family doctor. There was a patient, a reflexologist, who came and see me to ask me to treat his erectile dysfunction, but he has a blood sugar of 22. So I said, you treat your diabetes first before you treat the erectile dysfunction. I did a little survey which was published in the International Journal of Urology in 2002. And basically, my finding was that 10% of men with erectile dysfunction talk to the family doctors, talk to the GPs, and only 6% of men have the erectile dysfunction treated. And most people endure the erectile dysfunction for many months, sometimes up to 15 years. And again, many of these men in Kuching, when they come to my clinic, have hypertension, diabetes, psychological problems, and 20% of them have a low testosterone. Of course, this is like comorbidity with ischemic heart disease, or now they call it coronary artery disease. Now, we always hear in the newspapers of fantastic treatments, surgeries, laser, keyhole surgery, robotic surgery, etc., new treatments, expensive drugs, radiotherapy, but all this can have an effect on your sexual function. So if you remove the bladder, radical cystectomy, for example, you are damaging the nerves, the blood supplies to the penis, to the vagina, and to the ovary, and all this can cause sexual dysfunction, a topic which we seldom discuss about when patients go for treatment. So before you have treatment, please go and see your family doctor who will check your blood pressure, your pulse rate, do a general examination, examine your chest, your heart, lungs, your breast, examine your genitalia, check your nervous systems, and run simple tests like urinalysis, blood glucose, and the testosterone. Now, when we talk about medications for erectile dysfunction, we can't help but talk about Viagra. And Viagra came in the 1990s. Even in Kuching, we did a study on the use of Viagra, and we published in the year 2000. It's a very safe drug. After that, there are many other medications and treatments now. Another medication that we studied also was tadalafil, another medication. So there are many medications nowadays suitable for the use of treatment of sexual dysfunction. What is the latest medication which is in widespread use instead of tadalafil? 5 milligrams is low dose tadalafil. You use it after 3 days, you will be ever ready to have a good erection. And if it's not good enough, you can still add on a booster like sildenafil. Tadalafil has been reported in thousands of men. In fact, this study has 31,195 men in 118 clinical trials, and is found to be an effective agent, safe and well tolerated. How does all this medication work? They actually work on the penis to increase the blood flow to the penis. But of course, erection starts from the brain, stimulation, go to the brainstem, the spinal cord, the nerves to the pelvis. So it actually is a circuit. All this must be intact for a proper erection to happen. Now, no medication, no treatment is without side effects. Headache is very common. Vasodilatation or feeling warm is very common. Running nose, rhinitis, myalgia, muscle pain, some visual disturbances, and dizziness. And notice that even in placebo patients, that means patients who are taking a dummy, also have side effects. Generally speaking, these side effects are very mild and you don't have to stop the medication. Now, there's also talk about physical therapy. In other words, the patient have no surgery, no medications, and the favorite one that is used called a vacuum suction device. You can go online and find out what are the price. Basically, it creates a vacuum in the penis to draw blood into the penis to have a erection. And then after that, you have to prevent the blood from going backwards to put some kind of special rubber band with a gap at the lower part so that the patient can still ejaculate. Finally, a lot of patients want to have an injection to have good erection, but actually the erection is into the penis. Penis. I first reported this in the International Journal of Impotence Research when I was working in the GHK in 1990s. This is a very effective way of creating an artificial erection, but it involves an injection into the penis. And finally, when all fails, we can put a surgical implant into the penis. And there are many types of surgical implant. There's single piece, there's 3-piece, and unfortunately the price is very high, 20 to 40,000. And the implant doesn't reach to the tip of the penis, and there's no increase in blood flow. So the disadvantage, of course, is a surgery. They can have infection, can have bleeding. One of the major disadvantages that the tip is cold and soft, cold and soft. But it does help a lot of people who are like end-stage penile failure. Then there's just one slide on testosterone. In a study done in Petalinjaya, they found that they also have about 20% of patients with testosterone deficiency. And testosterone is important not only for sex, for ejaculation, but also for the brain, for the muscle, for the bone. And if you have low testosterone, you tend to have worse metabolic syndrome. So testosterone is an important measurement by blood test, and you need to replace it if it's very low. Finally, your lifestyle, your diet, your exercise is also important for good health, including sexual health. Except there's one exercise not so good for the penis, and that is cycling, especially you're cycling on a very hard saddle. It causes compression on the blood supply and nerve to the penis. Now, we have a lot of cancers. People are living older nowadays. So there's one such study who says that even if you don't have a good erection, even if you don't have sexual intercourse with the penis, you can still have an orgasm. But of course, in elder people with advanced cancer, you require more sexual stimulation, but you can still have a sexual life. Finally, a word on fertility. Now, fertility relies not on the erection or on the ejaculation completely. It actually relies on the sperm from the testicle. So if you can harvest the sperm from the testicle and inject it into an egg, an ovum, like so, it's called intracytoplasmic sperm injection, and the embryologist is there. As you harvest the sperm, you make sure the sperm is mobile and is good quality, and inject into the egg, you can still have a baby. That's called a test tube baby, test tube baby. So I hope you've enjoyed my short video.